You're listening to the Autism Weekly podcast. Each week, we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. This week, we're joined by
Dr. Amy Keefer, a board-certified psychologist at Kennedy Krieger Center for Autism Services, Science and Innovation, and assistant professor at Johns Hopkins University School of Medicine. Dr. Keefer is a leading expert in autism and anxiety research, and she's here to discuss an exciting clinical trial on a novel anxiety treatment for 4 to 6-year-old autistic children. Welcome to the podcast, Dr. Amy Keefer.
Oh, my pleasure. Great to be here today.
I'm excited to talk about this because oftentimes when we're talking treatment or any sort of support for autistics, is that anxiety is kind of on the side. It's looked at as comorbid versus a bulk of what we could be focusing some of the treatment on from the get-go. And a 4 to 6-year-old, it seems like it's that early intervention time where we can start to be able to help them process some of the anxiety that happens. But before we get there, I'd love to hear how you got into the field, how you got into research.
Sure, yeah. So I have enjoyed getting to know autistic individuals for, I'd say, 20 to 30 years. And just in the course of my graduate work, really just fell in love with working with children and young adults on the spectrum. My interest in anxiety, I think, really came out of that work. I saw high rates of anxiety, and often in a lot of the people I spoke to, and these were often school-age children, teens, young adults, the anxiety was the biggest thing they were often dealing with. Some people think it might be autism traits, but it really wasn't. It was more the anxiety that was getting in the way of having the lives that they wanted.
Mhm.
And what's really interesting is while our field, I think, has made some nice gains in our understanding of how to help people on the spectrum with anxiety, there are still a lot of places where we don't know enough. We have some treatments that help some people on the spectrum, but they are limited in terms of the age range of the kids who really benefit. The children generally often need to have pretty strong language skills, the average cognitive functioning, so that leaves out a lot of groups. And even when we're using those interventions, they don't always respond quite as well and perform quite as well as we would like them to. So there's just a lot more work to be done. And I think kind of the combination of seeing the impact and also kind of knowing there's so much that can be done to help that really attracted me.
Yeah, and it's a question that I think that we should all be exploring a little bit more. And you have a clinical trial that's going to be looking at this very specific issue. So maybe you can give us a little bit of a background of what your current role is with Cassie, but also what is this clinical trial, DINOSAUR, and what is it exploring?
Sure, yeah, I'd love to. So I wear a lot of hats at Cassie. Probably the two that are the most interesting are that number one, I am a clinician, so I provide diagnostic evaluations to children with a wide range of ages. And then I'm also a mental health therapist. So I'm treating school-age children, teens, and even younger children in the clinic for things like anxiety and emotional dysregulation, and also just adjustment issues that might come up for kids. But then my other hat, one of my other hats, is as a clinical researcher. And so I work very closely with a colleague here, Dr. Roma Vasa, who is a wonderful child psychiatrist. And we have a number of studies really trying to dive into looking at anxiety in autistic individuals from a variety of standpoints. The trial that I'm currently leading that I'm really excited to talk about is the DINOSAUR clinical treatment trial. So this is a trial where we are piloting a novel treatment. As you said, it's for 4 to 6-year-olds. The reason we're targeting this age range is number one, we know from some research we've done over the last 5 years that anxiety can often start very early in kids on the spectrum. In fact, the rates of anxiety in children under 6, under 7 for that matter, are double what we see in non-autistic children. So 30% of 3 to 6-year-olds have anxiety.
Wow.
And we don't have really any treatments for this age range. The treatments that have been approved really start for around age 8, and then they go up till kids are teenagers. But we don't really have treatments. And I don't think it's something like you mentioned at the top of this talk that people think a lot about in this age range. We think about, really trying to help with behavior, trying to maybe, if there's some autistic traits that are causing challenges, maybe there's something there that we might help support, but we're not really thinking always about these kind of more internalizing mental health conditions, even though they're really prevalent. So anyway, DINOSAUR is a way to offer some intervention for kids in this age range that are already starting to deal with these problems.
Is there a difference in the presentation for a neurotypical 4 to 6 year old versus somebody who's autistic that might have caused us not to treat the autistic individual, where we would probably be helping with some form of mental health therapy for that other child?
So yes, there can be some differences. In some cases, I think anxiety can look very similar in autistic individuals and non-autistic, but there can also be some differences. And I do think it might be a little more, those differences might be more present in the younger children. Young children have a hard time talking about their internal experiences. They have a hard time really even identifying what they are a lot of times. And so they often have a hard time communicating that they're feeling anxious. And so what we often see on the outside are things like tantrums, or we might even see more autism traits like more repetitive mannerisms or more difficulty with sensory stimuli, or just kind of refusing to do things that I think then can get classified as something other than anxiety. And so I think it could be really easy to miss it. Plus, often kids in this age range have lots of things going on that we need to help them with. And so sometimes the anxiety sort of falls down lower on the priority list, which I completely understand. But we also know that anxiety can stick around and cause more problems later. So I think it's really important that clinicians and parents and teachers are thinking about it more.
Well, let's say you've been in the field for, I think that you said, about 25 years. And when we
Yep.
look at the history, times stereotypical behaviors in autistic individual that might be coping mechanisms, we thought we needed to change those or eliminate those maybe 20 years ago, 15 years. I think it's getting better, where we're starting to realize that they're not debilitating. Sometimes they are soothing and calming. Is that one of the things that maybe we should be a little bit more attuned to, is understanding the body language of an autistic child and seeing how they're demonstrating anxiety? And instead of telling them, no, you can't do that, is really trying to work with them and understanding what they're trying to be able to tell us and what they're offering to the communication that way.
Yeah, absolutely. I think often what parents will see is that there can be changes in some of those behaviors when the child is anxious. And so
Mhm.
really that can be a signal that something could be different and going on for the child. That doesn't mean we're going to try to change those features at all. It's really more, oh, this is a signal that there's something else going on, and in this case, potentially anxiety, that we need to provide more help with in some way. There's also some really interesting, I think, things that happen for autistic children where a lot of the sensory challenges that children have can also often be a source of anxiety. And so it's really important that we're thinking from a kind of both perspectives, like how do we support the sensory needs, but also helping the child face things that make them anxious, that you wouldn't
Mhm.
necessarily always be targeting in children who aren't on the spectrum.
Yeah. And I mean, it makes it's hard because you don't
Yeah.
know which end of the scale you're looking at any given time. Be telling parents, because the parents are the ones who are going to notice this first. They're the ones that are going to be able to communicate that. They're that first line of information always for any sort of clinical intervention. Is what can we be telling the parents to maybe attune themselves to understand the difference between, this might be anxiety, this might be something more than just some of the characteristics that they might have always seen in their child, and this is telling us something different now.
Yeah, so I think, one of the big things we do in Dinosaurs, we spend quite a bit of time helping parents learn how, to the best of anyone's ability, because this is never a perfect science, how to differentiate the autism from the anxiety, because we're going to have very different approaches. Things that are autism, we're going to think more in terms of supporting, we're going to think more in terms of potentially teaching skills. Anxiety, in some cases, we're helping children actually face some of the things that make them scared, which is a kind of a very different perspective. So, number one, I think, is talking to parents about really educating them about what these things look like and how they can be different. And then we try to give them some really hard, fast tools to try to tell the difference. Even though I said that a lot of times anxiety can present behaviorally, often there still are some signs, if you're looking carefully, to suggest the child might be anxious. Like they're might be hiding their face, they might be clinging, they could be shaking. There's often some behavioral signs that you wouldn't see in other contexts that might point a little bit more to anxiety. We can also look at what's triggering those behaviors. If they're the kinds of things that tend to trigger anxious responses, like in young children, that's often if they're asked to separate from their parents, or they're being asked to enter, some sort of social situation, or some kids will have specific fears of things like pools or dogs or big animals. Those would be more likely signs that, oh, there could be some anxiety going on. So we really try to help parents have a couple of key things they look for and then use those tools to tease apart, could this be anxiety or is it just autism?
Well, let's dig deeper into the dinosaur treatment because the first step is the educating. But you had mentioned earlier is that the treatment has not really been tailored to 4 to 6 year olds in the past, and that it's something that we need to educate ourselves more on, and that's what the clinical trial should be doing. But what is your thought process on, all right, so we've coached parents on being able to recognize, how do we start treating these anxiety provoking moments and the ability for somebody to be able to process through them?
Yes. So Dinosaur is based on the cognitive behavioral therapy model of treating anxiety. We use that model as our starting point because that is what has been demonstrated to be efficacious in older autistic children, so school-aged children and teens. But then we had to make a lot of modifications, obviously, for the children's age range. And I'll just also say CBT, cognitive behavioral therapy, has to be modified for autistic individuals as well for it to really kind of fit with what the needs are of that group. So we made a number of modifications to just make it more feasible for this group. So things like lots of visual supports. As you mentioned, this is largely a parent-focused intervention. So we're not expecting, while we do include the children and we teach them skills, we're not expecting them to take these skills and use them on their own. We're really thinking the parents are the coaches who are going to be leading the children through this. 4 to 6 year olds just generally are not at a place yet where they're able to do that on their own. And then we also try to throw in a lot of things that make it really appealing to the child to get their buy-in and engagement as much as possible. So we use our dinosaur theme because that is something that a lot of our kids enjoy. To teach them different skills, we use storybooks and fun movement activities to really teach them, number one, a bunch of different coping skills for when they are feeling anxious to make it feel a little more manageable. We also teach the children a lot about recognizing their own anxiety and how to express and let their parents and others know when they're having those experiences, and teach them a lot about the different levels of anxiety. And then we give the parents lots of tools to help the children face their anxiety. We also teach the parents about recognizing the impact of their own anxiety, because we know that is another thing that can really impact and potentially even contribute to children continuing to have anxiety if their parents are responding in certain ways that might maintain that for them.
Yeah, I mean, you're treating the entire community around that child and empowering them all to be able to process. And I think that's an amazing thought process and concept to work. But when I think of cognitive behavioral therapy, and this is something that I think all clinicians that are working with children who have autism, is that it's being able to process and understand. All right, so there is a place for cognitive behavioral therapy within the treatment model. Is there a level of cognition that's required, or are you looking at, across the spectrum, level 1, level 2, level 3 for these 4 to 6 year olds, how to be able to change and adapt accordingly?
So right this minute, our trial is focused mostly on children who have generally, they have fluent speech and that they're using complete sentences, so that they are able to participate in the intervention. It is our hope, and we really think we are going to be able to modify this to work with children who might have less language. But right this minute, that's where we're at in terms of our testing of the trial.
And you said that you're working with families right now. how do we know if it's successful? I mean, are we seeing it as far as a quality of life measure? Are we seeing it as far as a clinical measure where we're actually able to kind of look at numbers? I don't know if there's numbers to be able to look at through this process, but in your research design, how are we judging success?
So I think all those things. So we originally did a trial where we just looked at feasibility. Like, was this intervention, is it something that parents feel like is possible? Is it something they feel like has the potential to help their child? Did they like it? And so we did a small feasibility trial that had some really positive findings, both in terms of parents thinking it was helpful and that they were engaged. The children, they thought their children really responded well. And we had some very initial findings that suggested it might be helpful. And so now we're running a randomized control trial where we're comparing DINOSAUR to an active control. So some parents who come into our trial will be in the DINOSAUR and receive that intervention. Others will receive a different type of intervention that's not quite as focused on anxiety. And we're comparing to see, really, does DINOSAUR seem to have more of an effect over the control condition? And there are a number of measures that we use to assess anxiety. So we do have some pretty strong strategies to assess outcome. So one of the measures is a very comprehensive parent interview that digs into all of the different anxiety behaviors that the parent might be seeing, and then it gives different clinical severity ratings to the different types of anxiety disorders that the child might be displaying. And we'll compare those numbers pre and then post after the intervention to see if there's been a change.
I love the fact component to it because that's the one piece that as you're looking at, those successes and whether it is the parents feel more empowered, the child is coping better, having that piece to it will help to support strategy over time. So what I'm going to be doing when my child is demonstrating anxiety that you're coaching or that you're teaching through this process.
Yeah, so we're teaching a lot about, like I said, different coping skills that the child can use, things like, some relaxation skills that they can use when they're feeling very anxious. And then there's a lot of skills around the parents, helping their child with figuring out ways to face fears. We also can teach a lot about really kind of managing the environment and increasing predictability in some cases. That could be very helpful. So using things like visual schedules, social stories, looking for ways to help the child anticipate what's coming next. Can be another way that can be really helpful in managing the child's environment and bringing down their overall anxiety levels.
Do you see this as a way where clinicians and families might start to prioritize this earlier in treatment, and this might be something that helps to open up more skills and empower the child to be able to learn their way of engaging the environment differently?
Absolutely. That's one of the reasons we keep the children involved. We, again, it's a parent-focused intervention, but we do think there's value in the children learning to recognize some of these signs themselves. We're starting to recognize what some of those physical cues are and what they mean, and even starting to plant the seeds about some of the coping strategies that they use. I think that's a really important thing and can set them up for later success and more, I think, empowerment to manage these things and even just understand themselves in the future. I also think it's very important that we start getting the word out as a field to families, as I said, clinicians, teachers, that anxiety and paying attention to this in young children is important, and that we have to be monitoring, detecting this earlier, and then helping kids manage it earlier, as opposed to waiting till children are a lot older. In which case, sometimes it can be harder to treat and it can stick around a little bit longer and be a harder thing to manage if we wait a lot longer to handle it. So I think finding it sooner is going to be better outcomes.
Absolutely. And when you're talking 4 to 6 year olds, and you just mentioned the education system being a critical piece to this, is there a thought that, when we're looking at the entrance into school, or even those preschool age children that might be receiving care within the school districts, is that within their IEPs, within the teaching paradigms, is that we can start to incorporate some of this anxiety reduction strategy there too, because it's important throughout the day.
Absolutely. One of my colleagues at the University of Colorado, Judy Reven, is doing a lot of work looking at school-based anxiety intervention in autistic children, older autistic children, but looking at if we can really empower school systems to utilize modified cognitive behavioral therapy strategies in the schools to really target this right at the source. And she's having some, I think, some really exciting findings about that, about its feasibility and its efficacy in that setting. And I think the more we are able to kind of do that, the more success we're going to have, because often that is one of the biggest places that kids on the spectrum and kids not on the spectrum are having anxiety. So I think if we could build that into their real lives like that, that's our golden ticket for improvement.
Absolutely. And I've spoken to a variety of researchers, and one of the challenges is making people into the studies to get all this wonderful information. So when we're looking at whether it is a family who's thinking, is this right for me, or a organization, or even a school district saying, hey, you know what, this family would benefit from not only being a part of the study, but being able to learn through that process. So contributing long term by saying, hey, you know what, all this information about how my child might respond to DINOSAUR is going to benefit others, but it will have an immediate impact on the way that the family can actually work and function and support their child. Now, how do we identify those families? How do we get more participation in the research?
That's a great question. I think we're always looking for ways to connect more and really get out in the communities to connect more with families and get them involved in research. I know within CASI, we have a lot of wonderful supports and initiatives where we have members of our research team that go to different community events to try to really kind of, that grassroots level, connecting with families and telling them about research that's out there. But we do know there are groups that we're still not reaching and that are chronically underserved by research. So I think that's something our field needs to keep working on to figure out how to connect and give these opportunities to everyone, and not just people who necessarily have direct connections to us. But certainly within Kennedy Krieger, there are websites that talk about all of our different research studies that are available. There are a number of opportunities, within, like I said, community events to hear more about these opportunities. Our site in particular has everything going on at CASI, if people are interested in looking at the things happening specifically for autism there.
When you were talking about being able to help variety of people that could benefit from being a part of the research, what comes to my mind is underserved populations, areas where geography might be limiting. Is this a virtual technology as well? Is there something that's available that way?
Yes. So I didn't even talk about that. That's another innovative element of DINOSAUR. So we actually launched our initial DINOSAUR study in early 2020. And we had envisioned it as an on-site, people would travel to our office to receive the treatment because that's sort of how outpatient care was delivered. But because of the COVID pandemic, we had to quickly shift gears. And so we redesigned it to be a virtual intervention. And as a result, we actually kind of fell in love with that format. We found, particularly again, families of kids in this age range have so much on their plate. And the thought of them having to travel to the clinic was just, I think, being able to alleviate that burden for them was wonderful. And I think it has helped us connect more with folks who may not live in areas that are close to our clinic, or for whatever reason or another, participating in a research study has been more challenging. So the virtual format, I think, has been really beneficial in that way. And so we've continued to deliver this virtually. And we actually are shifting to trying to make all of the elements of study participation virtual, so we could essentially even treat people outside of the Maryland state, and hopefully even across the whole of the Eastern Seaboard, if people wanted to participate.
Well, that leads us to the obvious question of where can people find the information so that if they feel like they would benefit, that they can sign up to be a part of that trial.
Yes. So as I mentioned, the CASI website has a particular page that's all about our different research trials. And so there is information there with links where either people can fill in information if they're interested or give a call to one of our wonderful research assistants, and they will get you started in the process.
Well, in the meantime, is that there's so many families out there that maybe have changed their whole life, don't go to places because the anxiety that their child feels it's causing them to act differently or to limit opportunities. What would you be giving for advice for families as they're navigating anxiety right now? Because it can be debilitating to a family.
Yes, I think the number one thing is to not just push that under the rug. I think to feel empowered to speak to your providers about it. If you're not already connected with someone who's a behaviorist or mental health provider, that you're reaching out and connecting with someone with that expertise. I know it can be extra challenging sometimes to find someone with the dual expertise of mental health and autism, but working to try to make that connection and finding someone, I think could be a really useful tool. That said, I also know tons of educators that have lots of wonderful ideas about how to help with some of the things I mentioned, like increasing predictability in the child's daily life, how to really even teach your child some basic coping strategies when they are anxious. Reaching out and trying to make those connections and get that information, I think could be really helpful. But really just not staying silent, asking for help, getting assistance. Also, I think with that question of figuring out, is this anxiety or not? It's tricky. So getting some experts involved and really trying to help differentiate that is going to be important.
That is absolutely wonderful advice. And being silent is the only way that I think that we don't tackle challenging problems. And as the more that you can voice it, the more you can let people know. Or if you're seeing changes in your child that you don't understand as a parent, those are good things to raise to your team and get more information and challenge them to come to the plate if they don't have an answer, to make sure that they're getting other people involved and getting other professional support to be able to make sure that your treatment plan is going to support your child. So I think that that's apt to make sure that the parental voice is being amplified as much as possible, but the parent should speak up too and make sure that they're never feeling like they're just an outlier to the treatment, as that they are guiding that process. Well, Dr. Keefer, I appreciate you coming on today and talking about anxiety, talking about the DINOSAUR clinical trial, and making this something that's the forefront rather than something in the background of intervention, because I think it's going to help us all in the long term.
Oh, well, thank you so much for this opportunity. It was great talking to you today.
Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.